Hello, and thank you for joining us today. My name is Bailey, and I will be providing technical assistance during the webinar. Closed captioning and ASL interpreting are being provided. To view the captioning, click on the CC icon at the bottom of your screen and select Subtitles. You can also view the captioning by clicking the link in the chat box. This will allow you to open the captioning in a separate tab and resize the font if needed. To view the interpreter, set your screen to gallery view. You can switch between gallery and speaker view in the upper right-hand corner of your screen. All attendees' microphones have been muted to avoid background noise, and we ask that you turn off your webcams to allow attendees to easily view the interpreters. During the Q&A and discussion session, please use the chat box. Select the moderator's name and type in your question. The moderator will read your question aloud for the presenters to answer. This webinar is being recorded, and the recording will be made available for future viewing. It is now my pleasure to turn the meeting over to Dr. Rashida Parks, Executive Director of the Interagency Committee on Disability Research. Please proceed.
Thank you so much, Bailey, and good afternoon, everyone. Welcome to the Interagency Committee on Disability Research, ICDR Lunch and Learn webinar series. As mentioned, I am Dr. Rashida Parks. I'm the Executive Director of the ICDR. And for a visual description, I am an African-American woman with short black hair, dark brown eyes. I am wearing a black blazer, white shirt, and glasses. My background is the blue and white HHS and ACL logo. On behalf of Dr. Anjali Forber-Pratt, the ICDR chair, and the director of the National Institute on Disability, Independent Living, and Rehabilitation Research, NIDLR, and Dr. Christy Hill, the Deputy Director of NIDLR, I would like to welcome you all to our April Lunch and Learn webinar entitled Disability Cultural Competence in Healthcare. I will now turn our webinar over to our moderator, Robert Oxendorf, who is a program director at the National Science Foundation, or NSF. He works on fundamental and applied research programs in NSF's STEM education directorate, focusing on pre-K through 12 STEM education. His areas of interest include early mathematics education, educational neuroscience, cognition and STEM learning, science education, and intervention research to improve STEM learning and accessibility for students with disabilities. Prior to joining NSF, he was a program officer at the Institute of Education Sciences at the U.S. Department of Education for 8 years. Rob is also a former high school science teacher. So without further ado, here is Rob Oxendorf.
Thank you, Rashida. Appreciate that. Happy to be able to moderate today's session. We have two great talks lined up. We will go through both of the talks and then have time for questions at the end. Questions will be handled in the chat, and I will read those out to the presenters. Our first presenter is Amanda Krupa. She's currently the Director of Communications and Marketing at the American Health Information Management Association. She previously served as a contractor on the CDC COVID-19 Vaccine Task Force, as a member of the Web Content and Pediatric Vaccine Implementation teams, and was the editor of healthychildren.org at the American Academy of Pediatrics for over 8 years. She holds a master's degree in health communication from Boston University and a postgraduate certificate in medical writing and editing from the University of Chicago. She is an advocate for health literacy, health equity, and improved access to care, especially for people with disabilities. Our second presenter is Dr. Arielle Silverman. She's the Director of Research at the American Foundation for the Blind, AFB. Prior to joining AFB, Dr. Silverman served as an independent research and training consultant, specializing in disability research and inclusion training. She has also worked as a technical writer for the National Rehabilitation Information Center and as a postdoctoral fellow and research scientist at the University of Washington Department of Rehabilitation Medicine. Dr. Silverman has co-authored or authored more than a dozen peer-reviewed research articles, and she has experience with conducting both quantitative and qualitative research related to blindness and visual impairment. She has also presented inclusion workshops to nonprofit organizations, for-profit companies, and professional associations. She holds a BS in psychology and biology from Arizona State University and an MA and PhD in social psychology from the University of Colorado at Boulder. In addition to her research and training work, she has co-directed a pre-employment transition program for blind and low vision youth in Virginia. Her research interests include disability identity, employment, methods of improving public attitudes about disabilities, and neurodiversity. So thank you, and I'll turn things over to Amanda for our first presentation.
Good afternoon, everyone. I'm Amanda Krupa. I'm the Director of Communications and Marketing for AHIMA Foundation, which is a nonprofit organization and affiliate of the American Health Information Management Association. As part of our Health Literacy for Health Equity initiative, this research that I'm going to present to you today on the critical role of web accessibility in health information access, understanding, and use was part of our research goal to zone in on the Healthy People 2030 goal, to increase the proportion of people who can view, download, and send their electronic health information. To do that, in our purview, we first wanted to understand the barriers to access among vulnerable groups within our population. During Digital Inclusion Week, which was October 3rd through 7th last fall, my co-authors and I published an issue brief titled, the title of this session, and a subsequent editorial in Stat News. Next slide, please. Today, you'll learn key insights from a web accessibility audit of over 100 top US hospital website homepages, a survey of older adults and patients with disabilities on this topic, and our findings from conversations with staff at some of the top scoring hospitals from our audit. I'm also proud to share that this research and reporting from our small, tiny foundation was named a finalist in the National Institute of Healthcare Management, or NICM, Digital Media Award for 2023 that recognizes excellence in digital media that improves understanding of healthcare topics through analysis grounded in empirical evidence. In the chat, you'll get a link to all of the finalists for 2023 for those interested in reading some of this innovative research and reporting from others, with the brands on the screen listed. Some of them are NBC News, Scientific American, Kaiser Health News, and the like. Next slide, please. So this study was published in October 2022 and utilized the 2021 to 2022 US News and World Report's best hospital ranking to get a total of 106 total hospitals. We reviewed homepages only, as they represented the digital front door and provide patient portal access. As many of you know, the US News and World Report analyzes the top hospitals on an annual basis. The honor roll includes a list of 50 hospitals in the country across all categories. They also rank hospitals by specialties. We use both the honor roll and the specialties that would include the patient population most likely to have a condition that would limit their digital accessibility. This included the rehabilitation, geriatrics, diabetes, endocrinology, cancer, cardiology, and heart surgery lists. Many hospitals were on multiple lists. So for those, we only use each hospital one time to reach a total of 106 hospitals. We then use Access Scan, a free online evaluation tool designed to give an overall compliance score for a web page. And when I say compliance, I'm talking about WCAG compliance, or the Web Content Accessibility Guidelines. Recently issued guidelines on web accessibility and the ADA was issued by the US Department of Justice Civil Rights Division and include WCAG. Automated scanning tools are available as quick and dirty option for reviewing accessibility of a web page. These scanning tools are use artificial intelligence, but they cannot replace the accessibility testing that would be done by a human. However, for the purposes of raising awareness and highlighting this issue, these tools are helpful, giving you a baseline. I also wanted to note that we only looked at these hospitals' homepages at one point in time, like a snapshot, how they did at that day at the time we conducted the test. Last week, I attended the HIMSS National Conference, and many companies were using the term digital front door in the context of patient experience. A hospital's homepage is really just that, an entry point to log into their portal, pay a bill, use telehealth, find a doctor, and more. But I'll add that I didn't see anyone at this global conference of 40,000 people talking about digital front door in the context we are here today. Next slide, please. On this slide, we have the percentage of hospital homepages demonstrating by scanning tool compliance, demonstrating scanning tool compliance by their hospital ranking list type. There was sort of a bell curve in terms of the accessibility of the home pages on the screen in this country. The table shows us that most of the top ranked hospitals fall into the semi-compliant range. A bell curve is fine when you're discussing traits that occur in a population, but in terms of digital accessibility, it means that many hospital websites are failing their patients. Only 10.5% of the homepages of the honor roll hospitals, the 50 best hospitals in this country, according to U.S. News Report, World Report, fall into the score of compliance. And about 12.2% of the homepages of rehabilitation hospitals. While we're heartened to see that rehabilitation specialty hospitals have the most homepages that met the compliance criteria, they're likely to have the most patients with conditions that would hinder digital accessibility. We would like to see that percentage much higher. It is important to remember semi-compliant means that something isn't compliant to someone, which makes some or part of the web page inaccessible to them. For their purposes, that website might not be compliant or accessible at all. Next slide, please. On this slide, we have data showing the number of wave errors by type across over 100 top ranking hospital homepages. Wave accessibility evaluation tool is integrated into the access scanning tool we use. By far, the most common errors were contrast errors, followed by empty links and missing alternative text. Contrast errors affect users with visual impairment, including color blindness, and include diabetic retinopathy, cataracts, and glaucoma. Only 3 sites had broken skip links, and I wanted to call that out because it's an area I see many organizations on the whole World Wide Web could improve upon in terms of their user experience. It also really benefits folks with motor impairments who navigate the internet with a keyboard instead of a mouse. They also improve the experience of those who use assistive technology to navigate the internet. Many folks with autism do as well. Next slide, please. I want to mention our study limitations. We did use an automatic accessibility testing tool. They do have limitations. You can compare it in healthcare to screening versus diagnosis. Accessibility testing tools don't guarantee compliance from a legal perspective. And although the term semi-compliant gives that impression, I mentioned that a website would need to only, would need only a few fixes to be compliant, but for patients with disabilities, a semi-compliant site is one that they will likely have trouble navigating. Next slide, please. Now the part I love talking about. Back in August of last year, we conducted a qualitative survey with older adults and people with disabilities to document and understand their patient experiences when accessing their health information electronically. I wasn't able to find much on this topic documented anywhere previously specific to this topic, and with a diverse group of people with different needs. Key findings we were able to document were older adults and patients with disabilities face barriers to accessing their health information electronically. And many use some form of assistive technology and have struggled to use a hospital website and or patient portal. Next slide, please. To recruit participants, we worked with a great organization called Knowbility, a nonprofit organization whose mission it is to create an inclusive world for people with disabilities. Participants included those who have low vision, have mobility-related disabilities, are deaf or hard of hearing, and have a cognitive disability. Other organizations also helped promote this survey through their network to increase the sample size and obtain additional perspectives from people with disabilities and older adults. And naturally, because I'm a health communications researcher in this capacity, I do want to mention the limitations of this survey. Participants already had some form of internet access and digital literacy needed to complete an online survey, and it was only available in English. We only collected data from 22 people during a 2-week period. But there is a great opportunity for this work to be replicated at the hospital and health system level to understand barriers for their own patients and in the context of their own site and patient portal instance to really have an impact. Next slide, please. I'm going to go through now some responses because I think people remember stories more than facts. Is it easy for you to access your health information electronically? For example, blood test results or after visit summary. Corb, a 34-year-old man with a disability living in Minneapolis, told us no. The data is often presented as charts or tables that aren't readable with a screen reader. Additionally, many times the data are only available as untagged PDF, which means I cannot easily move around the document except read it from start to finish. Next slide. When using a patient portal like MyChart, are you able to navigate to the information you need? Sasha, a 37-year-old woman with disabilities from Austin, Texas, said, partially, only because with radio buttons, the radio buttons are labeled correctly. If there are graphics, even with alt text, VoiceOver or JAWS will simply say graphics, rather than reading me the text in the picture. Next slide. Tell us about a time when you struggled to use a hospital or healthcare website, access your health information, or set up a doctor's appointment. Ralph, an older adult from Chicago, told us, I tried to go to my health system website, but I was unable to adjust the font big enough so I could see it. Next slide. Now, it's not all gloom and doom. We did want to have some success stories. So tell us about a time when it was easy to access the hospital website, access your health information, or set up a doctor's appointment. What made it easy for you? Ryan, a veteran living with multiple disabilities in Madison, Wisconsin, told us, I like the VA healthcare website, which syncs up well with my assistive software. There are a few problems on that one because of the compatibility. Now, we also did 3 short audiogram videos in a series called Making Health Information Accessible, and there'll be a link to it in the chat. One of them does feature Ryan and the VA's My Healthy Vet website, as I know we have many folks who might be from that agency on this call. Next slide, please. After our editorial and stat came out, we were contacted by a couple people in quality roles at hospitals interested in how their hospital fared in this specifically. We decided to programmatically look for contacts at hospitals who might have roles in this space, which was a very manual process, and email them a copy of this research and information on how their specific hospital homepage fared. We focused on the top 30 scoring hospitals and were able to have discovery calls with 4 of them, the 4 listed on your screen, to essentially gauge how are you doing this and how are you doing it well that we could potentially inform others. I'm going to call out some of the things they told us. Northwestern Medicine has a designated ADA coordinator leading digital accessibility at their organization. And she is currently making an internal style guide after taking a course herself in early 2022. So very recent. And I will also note that their patient portal team is separate from their website team. Their mobile team, their app team, is within their IT department and separate from those two teams. At Rush, they rebuilt their entire website from the ground up in 2020 with accessibility prioritized. And they have each Rush employee must have a performance goal around equity, and many in the tech space in their hospital have accessibility as a tie to equity in their role. The University of Wisconsin Medicine in 2020-21 hired a head of digital experience. This was a new position for them, and the person they hired is from Microsoft. And he told us that senior members of his team only know WCAG because they previously worked on government contracts in other organizations. He also told us that they are very connected with the university side, University of Wisconsin, Washington, that has an entire digital accessibility team for the education side. And they employ people on that team with disabilities, and they utilize them to help test their website. Mount Sinai told us that in 2019, they started a cross-departmental steering committee looking at accessibility, both physical and digital, institutionally. And they told us that their Epic team and their My Mount Sinai teams are separate from their digital marketing team, which handles the website. They also told us a lot about the difficulty with translation, which are a slower process and in progress with accessibility, but an even bigger hurdle for them. Next slide, please. So in summary, I just wanted to call out these 4 things. Beware of the quick fix. You're going to see on many websites out there little accessibility symbols appearing. These are called accessibility overlay tools, and they're powered by AI. But sometimes they can make accessibility issues even worse, and there's a lot of data to back that up. Collaboration is key. Collaborating across departments in the hospital will help ensure digital accessibility issues are addressed and patients' needs are met. 3, more education and awareness is needed on this topic overall. We recommend hiring a full-time employee to oversee digital accessibility efforts in the hospital or hospital system, rather than contracting out remediation work for a one-time website overhaul. Have a digital accessibility coordinator and set up a work group that includes decision makers from all departments, especially those working on the patient portal. More funding and opportunities are needed to be available to support hospitals and hospital systems with this digital accessibility and translation of these experiences. Outside of the federal and state government, knowledge of 508 best practices is very, very lacking. Accessibility takes time, expertise, and dedicated funding. Next slide. That's all I have for you today. Thank you so much for listening. You can visit ahimafoundation.org for more information, and you can contact me at amanda.krupa@ahimafoundation.org. Thank you.
Thanks, Amanda. That was great. Super interesting and important research around accessibility issues in healthcare. We will switch over to Ariel. And as a reminder, questions for Amanda and Ariel in the chat, and we can handle those at when Ariel finishes. So Ariel, over to you.
All right, thank you so much. So we should be on slide 1 here. I'm going to be talking about the American Foundation for the Blind and some research and guidance that we have on making healthcare accessible for people who are blind or have low vision specifically. Next slide, please, slide 2. So before I get into the findings from 2 research studies that we've conducted recently, I wanted to start off by sharing a couple of patient quotes because I agree that sometimes stories can be more memorable than statistics or research findings, and these quotes illustrate a couple of issues that can come up in communication between providers and patients who are blind. So the first quote is from an individual who is blind, who went a couple of years ago to get a COVID test at a hospital. And her father, who's sighted, drove her to the appointment. And so she was writing about how the person doing her COVID test directed all of the questions to him. So asking him what her name and birth date was, and she answered. And then the person kind of didn't get the hint. And then they asked him, or gave him information about the fact that they were going to be doing a procedure at the hospital. And so this is something that happens frequently, that is frequently reported, where people who are blind or with other physical disabilities are talked around in a medical setting. If they happen to be coming with a family member or companion, the provider might speak to the companion about them instead of talking to them. And then another quote that we have is from an individual who was asked, before leaving me to get ready for the procedure, the assistant asked me if I needed help getting dressed, and I felt so belittled. And that one's a little bit tricky because there are people with some disabilities who genuinely do need help getting dressed or undressed, and it's wise to ask whether that help is required. But people who are blind without any physical disabilities do not generally need that kind of assistance. And so this quote illustrates another phenomenon that has been known as disability spread, where people can make assumptions if someone has one disability that they also have other sorts of difficulties not related to that disability. So sometimes people who are blind are presumed to also have trouble with physical activities of daily living, trouble walking or climbing stairs, trouble with lifting, things like that that are not directly related to being blind or having low vision. Next slide, please. So on slide 3, we have some information about AFB. So the American Foundation for the Blind is a national nonprofit, and we work to create a world of no limits for people who are blind or visually impaired. And the ways that we do that are by mobilizing leaders, advancing understanding, and championing innovative policies and practices using research and data. And I am housed, and the research that we conducted was supported specifically by the AFB's Public Policy and Research Institute, or PPRI. PPRI produces research, original research, to understand the experiences of people who are blind or have low vision. We also advocate directly for federal policies that create opportunities and remove barriers. And we publish the Journal of Visual Impairment and Blindness, which has been around for over a century, providing peer-reviewed research on the education and rehabilitation of people who are blind or have low vision. Next slide, please. So 2 lines of research that I will briefly be talking about today. The first one that we refer to as the hospital project was 2 focus groups that were conducted with patients who are blind or have low vision, who had received services from a hospital in Huntington, West Virginia. So these focus groups were conducted to learn about their experiences and what advice they have for providers on how to provide more accessible care. I will also talk about our very recent study, just hot off the press last week, called the Barriers to Digital Inclusion Study. That was a survey of nearly 400 blind and low vision adults in the United States about access to websites and mobile apps in a variety of domains, but today I'm going to be focusing on access to healthcare related information using websites and mobile apps. Next slide, please. So first of all, some of the findings from the 2 focus groups that we did in West Virginia. In general, patients who are blind or visually impaired or who have low vision, what do they want? Well, they reported that they wanted medical professionals who are respectful, practice good communication, and assume competence on the part of the patient. So this is kind of getting back to what we saw at the beginning with these quotes, that people want to be treated with respect and dignity and to be presumed competent, capable of speaking for themselves, answering for themselves, and asking for and specifying the accommodations that they need. People also reported that they want information about their care and treatment plan, and they want that information to be in an accessible format. So sometimes it's presumed that an individual who is blind has someone at home living with them who can give them access to print information, and that's not always the case. Many people who are blind and low vision live by themselves and are self-sufficient, but they need a way of accessing personalized information about their health and their treatment plans independently. And so that can be provided through a digital portal, which is accessible. That can be provided in large print, in Braille, or by having someone orally read information to the person, and the person can write it down in the way that works for them. Effective care is something that everyone desires, and effective care is more likely to happen when there is smooth and respectful communication. Next slide. So digital accessibility, and this is building on, of course, some of the things that Amanda was speaking about. So healthcare is becoming more and more digital in terms of electronic health records. So using digital tools to look up personal patient information about appointment summaries, medications, test results, all those kinds of things are going more and more digital. Websites that providers may have that people can use to find a provider, schedule an appointment, handle health insurance related questions via the web. And then telehealth, of course, is becoming more and more popular, especially during the pandemic when it was required in many cases to make appointments and receive care via telehealth. Digital diagnostic and remote monitoring, including mobile health apps that people might use to self-manage their own chronic conditions or their own well-being. And ensuring accessibility upfront reduces costs involved in remediating barriers. So it's better to create a digital tool that's accessible from the beginning rather than creating the tool and then having to go back in later and fix things after accessibility issues have been pointed out. So that means procuring technology from third-party vendors, ensuring that the technology being procured is accessible, testing with experts, accessibility experts, and ideally experts who themselves are users of assistive technology to ensure that the digital tools are accessible across a variety of different platforms, and providing customer support so that if accessibility issues come up that were unanticipated, users have a way of reporting those barriers and receiving remediation. Next slide, please. So this is just a snapshot of some of the results to the recent Barriers to Digital Inclusion survey that have to do with healthcare. So this survey was much broader and covered a variety of additional domains besides healthcare. And if you go to our website, you'll be able to view and download the entire report. But in terms of healthcare related experiences, we found that most study participants reported that they do use websites or mobile apps to manage their health. So for example, about 70% said that they used a website within the last year to look at their medical records. And about half reported that they used either a website or mobile app to receive telehealth services in the last year, or at least they tried to do so. Out of just the participants who reported that they have used websites or apps for healthcare, depending on the specific task that we asked about, between 20% and 30% of these participants reported that at least half the time they ran into an accessibility issue. So whether that was with trying to find a doctor, trying to schedule an appointment, looking at their health records online, attending a telehealth appointment, or seeking mental health services, or seeking mobile health like self-management apps, meditation apps, exercise and fitness apps, all that kind of stuff. 20% to 30% said that at least half the time they had a barrier. And 40% to 50% reported that they had occasional barriers, meaning they had some barriers, but it was less than half the time. And of course, some of that varied depending on what providers people were working with. So there were there was a minority of participants who reported that they never have barriers. And in many cases, that's because they happen to be affiliated with a hospital or provider that is fully accessible for them. Next slide, please. So here are some recommendations that we have based on the research and based on our expertise as on the staff. We have several individuals who are blind regarding etiquette. So it's important that healthcare providers announce themselves, identify themselves, and provide verbal instructions and verbal previews of what's going to happen next, so that someone knows what to expect in terms of the care that they're receiving. Providing verbal directions if someone needs to move from one place to another. Speaking directly to the patient unless otherwise indicated, as we talked about earlier. And sometimes there are individuals who are unable to communicate verbally, and in those cases, it will become apparent if the person who is with the patient provides verbal response, but it's important to initially direct communication to the patient directly. Understanding blindness and low vision, so reading resources and learning about issues like different degrees of vision loss. Some people may have enough vision that they can navigate through space without using any mobility equipment, so they might not appear to be blind or to have low vision, but they might still need help with things like reading signs, reading maps, or completing paperwork that's in print, for example. So understanding those nuances is very important. And then, of course, if there's any doubt or any question about the accommodations that somebody requires, it's important to have that conversation and dialogue with them, ask them questions, and really listen to and respond to the information that the individual is providing about their own needs. Assisting with orientation. So some people benefit from verbal directions of how to get from one place to another. Others might prefer to have physical assistance, often by the blind or low vision individual holding on to the elbow of the individual who's providing physical navigation assistance. So again, that's a highly individual preference, and sometimes people, even the same person, may have different preferences on different days or in different locations, or depending on how they're feeling physically, for example. And so it's important not to make assumptions, but to be willing to offer verbal guidance or physical guidance. Generally, it's not preferred for someone to grab onto or hold on to the body of the blind person without the blind person's consent. So it's very important to get consent in those cases. And opening communication to understand patients' access needs. We've already covered that, but just understanding that every patient is different, and even the same patient on different days may have different needs. Next slide, please. Accessibility recommendations. So these particularly pertain to digital accessibility. It's important to ensure that websites and care portals comply with modern accessibility guidelines. And we heard earlier about WCAG, that's the Web Consortium accessibility guidelines. It's very important that websites, portals are tested to be compliant with those guidelines. Mobile apps should also be tested for accessibility, and there are companies and individuals who have the requisite expertise, who are assistive technology users and can test on a variety of different platforms. Provide assistance with forms and alternate versions of print materials. So some people may be able to complete forms using a website or a mobile app quite capably. Others may need assistance in the form of a reader scribe to actually help them with reading and filling in print forms, or they may be able to fill these forms independently if they get them in large print or using a magnifier or some other kind of assistive technology. So again, that's where it's vitally important to check in with the individual patient to find out what they need. It's also useful if you have a digital form to allow individuals to complete the form electronically and submit it via email or via a secure web portal, rather than requiring the individual to print out the form. and complete it that way, because someone who is blind or has low vision may not be able to complete a print form or even sign a print form without sighted assistance. And again, some of us don't have people living at home who can help us with that. Next slide, please. So here are links to some of our resources. We have a page on our website that is linked at the top here. Healthcare workers, resources, and so we have created about a 45-minute video presentation that is free for anyone to view or download, and that includes some training about blindness and low vision, about some of these issues around differences in levels of usable vision and different techniques that people use for travel and for access to information. These videos also include some scenarios, some interactive scenarios that you can work through to kind of identify the best ways to respond to specific situations in the healthcare setting. And we have a pre-test and post-test available so that you can test your knowledge and see how your knowledge has increased after viewing the videos. We also have handouts that can be easily downloaded and printed and are tailored to different types of healthcare workers. So I hope you will check out that website. Next slide, please. And then finally, here is my contact information. My name is Ariel Silverman. I'm the Director of Research at AFB. You can reach me via email at asilverman@afb.org. And we're always looking to talk to people who might be interested in partnering with us in our research. We are planning to do a continuation of the Barriers to Digital Inclusion study and really dive deeper into some of the specific challenges and consequences of those challenges that people encounter with websites and mobile apps. So we would definitely appreciate any feedback or anyone who wishes to collaborate with us, anyone who knows of any particular funding opportunities that would support our work. I welcome those kinds of inquiries. And you can also learn more about AFB's current research at www.afb.org/research. We have some research reports that were published recently regarding access to healthcare during the pandemic, for example, that might be of interest to some folks, and research on workplace technology and accessibility in the workplace. So I hope you will check out our additional research resources. Thank you very much.
Thank you, Ariel. Another great talk. Really appreciate it. So lots of good information here to consider. We have a couple questions in the chat, and I'll just read the first one. This is from Dean, and it's for Amanda. It says, thank you. I do not work with the website, but as someone working at one of these top hospitals, I understand our site is dependent on content management systems that could do more to provide support accessibility, quote unquote, out of the box. How can large organizations influence the vendors of these systems to pay more attention to supporting accessibility? As for the portal, we have communicated with Epic Usability and their MyChart accessibility team. If you don't have a connection with them, I'd be happy to introduce you. A question for you, Amanda.
Thank you. I think it was a lot of questions. Yes, I'd love an introduction. Thank you. We are only a staff of a few people that took on this giant issue. So we would love any support. I can tell you that I understand it's hard if you are a large organization, you have a site already. It's hard to remediate that unless you are going to and have funding to kind of start from the ground up in your digital transformation efforts to redo some of that. There's better technology if you implement it in the process when you're doing it. Doing it after the fact is going to cost so much more money and be harder. But that, can be a conversation if you can. In our paper, we talk about, as organizations are saying they're prioritizing DEI or ESG initiatives, say this can fall in there if you want to have the budget to do it and the team and the time. But for a hospital, Mount Sinai told us when they did theirs from the ground up, it's a multi-million-dollar project. So it's not a small undertaking, but if, you know, in research and funding opportunities that specifically would support this, you know, maybe we'll see that one day.
Thanks. That's great. Question for Ariel. Ariel, can you recommend any tools to help an individual with limited vision to navigate the challenges of onboarding new medications? Any best practices that you could recommend?
So this would be someone who is taking new medications.
I think that's right. Yeah.
Yeah, so I'm not the most expert person on low vision tools. I know there are magnifiers that people can use to read labels. There's also a company called Accessible Pharmacy. I think they're just accessiblepharmacy.org, that can provide kind of individually tailored accommodations to people regarding their prescriptions and their medications, so that it might be worthwhile to contact them for guidance. Because I know there definitely are tools that can be customized for the individual. And I think they would probably have more expertise than I would on that.
Perfect. Thank you. Another question here for both of you. From Randy, I wonder if either of you or anyone else will dive into disability using an intersectional approach. So for example, how disability and accessibility intersect with immigrant status, language barriers, etc.
I'd love to dive into the language issue. I kind of touched on it a bit. A long time ago, I worked on a grant to translate the website healthychildren.org into Spanish. And when we relaunched ahimafoundation.org in the fall, when this paper came out, I wanted it built to accommodate multiple languages. But these kinds of functionalities need to be built into the content management system at the outsource. If it's not, then it can't be done. So it goes hand in hand, but research on that is definitely needed, because it's, you know, a social detriment of health from both sides.
Yeah, I agree. And I think there's also complexities on the communication, patient provider communication side, of course, if there's a language difference. I think also like immigrants and people who have language barriers may not be fully aware of their rights or the best way to advocate for themselves within the system if they face discrimination or don't get the care they need.
I think also the literacy on understanding our healthcare system in the US. I'll tell a quick anecdote that we were at the HIMSS conference last week and met a gentleman from Canada and told him about our research. And he said, well, why would anyone go to a hospital's website? We wouldn't do that in Canada. We would go to our insurance website.
Mm-hmm.
And I found that so interesting, and probably the topic of another, you know, paper conversation around the education of immigrant populations and on how it works here.
Which conference was that, Amanda?
HIMSS 23, HIMSS.
Which stands for?
Health Information Management, something else with an
Okay.
S system.
Okay, thank you.
Yeah.
I'm not seeing any more questions in the chat so much, but I got a participant recommended AFB's webinar they did for RAISE on accessibility and toolkit, how orgs can make content accessible. So Ariel may know something about that, but a link has been added in the chat from Anne, if everybody can see that.
Yeah, that must have been before my time. I'm not
Okay.
familiar with that particular one, but I'm glad it was recommended.
I'll also plug, if anyone has interest in this topic, further research, funding opportunities, please contact me. We're definitely interested in where we can go next with this, but we need dedicated funds to be able to continue this program.
Great. Any role here for generative AI in any of this work? This is kind of a new area, but I'll just pose the question. Is there any potential application, use of these kinds of new technologies in this space? It's too early.
Well, we used an AI tool to scan them.
Oh,
Access Scan is an AI tool, but I don't think I'd like to see kind of a content management system that can auto-correct issues, errors. From a long-term compliance perspective, I think that there's always going to be issues. You know, even if you build it right from the beginning, people that work on websites, especially big ones like hospital ones, health system ones, they're changing every day, many times a day. So how are you going to make sure that what you're getting is compliant? We talked some with, you know, sometimes your hospital's brand might not be compliant. So you're at a rock and a hard place with that too.
Yeah, I know the technology is improving slowly with AI recognizing images and describing images. I think it would be really great to have a tool that could describe charts and graphs. So if someone had something in their patient records that was in graphical form that could be described, but I don't think we're there quite yet in terms of the accuracy of image description. And wayfinding also.
Great, thank you. We're coming up to the end of the hour. I'm not seeing any more questions in the chat, and I don't know if our moderators see anything else trickling in, but just want to thank you both again for these excellent presentations and thoughtful discussion around these important topics. And so I guess, Rashida, I'm meant to turn things back over to you.
Yes, thank you so much, Rob, for moderating this wonderful session. And also thank you, Amanda and Dr. Silverman, for this amazing presentation and for your responses to all of the questions from our attendees. I would also like to thank everyone who attended today's ICDR Lunch and Learn webinar. And if you have any additional questions that come up later for our presenters, please feel free to send them to the ICDR email, and we will ensure that our presenters get them and we can send you their responses. So we also look forward to you joining us next month for our May Lunch and Learn. So please save the date, May 17th from 12 to 1. And our next webinar is entitled, How Did the COVID-19 Recession Impact People with Disabilities in Rural America? So thank you again for attending and have an amazing rest of the work week.